I wanted to mention to you amendments to the Mental Health and Wellbeing Act. As I mentioned earlier on in this update, we are going to do some work around making sure consumers know their rights under the Mental Health and Wellbeing Act. So this part of my update is separate to that work, although it will be related to that work. And this one's not such good news for us. And I have to say, I was quite shocked and disappointed when I heard this news, that what was planned at the 1st of September is that Ambulance Victoria, paramedics could respond to mental health crisis in the community and provide that care and control, as it's called, in those situations. So what's happened is Ambulance Victoria have said they're not ready to do that. Paramedics aren't trained to make the decisions that they might need to change in those situations. So where that leaves us is care and control is with the police and also with PSOs, the public transport support officers. So we know that it's really critical for people about how they come into acute mental health care spaces, and whether they get apprehended or whether it feels stronger than apprehension, and how they're transported. And we know that this has outcomes for their treatment and whether their treatment is compulsory or not, and their experience in these settings. We know that people at their time of greatest need want healing, nurturing, and they're not always experiencing the mental health system in that way. So we were looking forward to this change for paramedics being available to do this in the community when someone's having really big challenges with their mental health. But the legislation is going to actually defer this and not even have a date for it. So we're really disappointed about this. There's a couple of other amendments that went up. One was that the Mental Health and Wellbeing Act didn't have a definition of parent in it. So the definition of parent from the 2014 Mental Health Act has been used. And also there were a couple of reductions in when IMHA, Independent Mental Health Advocacy, would be notified. One of those was about a security order being revoked, and one of those was around transfer. And so they're not huge in the context of this act, those changes. But the one I did want to talk to you about particularly today was that paramedics it has been deferred as to when paramedics will be supporting us as consumers in a really great time of need.